how are you? Now I'm gonna talk about the first model of human body care.
What is anatomy? It's the science that studies body structures and the relationship among them. The body positions. Basically is the anatomical position, where the person stands erect, the arms are hanging at the sides, with the palms facing forward. Body planes. There are three types of body planes. The sagittal plane, that it's a vertical plane that divides the body or an organ into right and left sides. Like this, divides this plane. The transverse plane. It is the opposite as this one because it divides the body or organ into superior and inferior, like this. And the coronal plane divides the body or organ into anterior and posterior, like this. Divided like this. The tissues can be classified in four types. The epithelial tissue, that is tightly packed cells that form a continuous layer. Connective tissue, cells that are widely separated by a matrix and contains fibers. An example of connective tissue is the blood. The muscular tissue, elongated cells called muscle fibers. The nervous tissue, made of cells found in the brain, spinal cord, and nerves. The integumentary system, which is basically skin but also includes nails and the hair. The skin is divided in three layers. The first one is epidermis, which is composed by epithelial tissue. The dermis, composed by connective tissue. And below the skin, but not part of it, there is a layer called epidermis, composed by adipose tissue. The functions of the integumentary system. The first one is protection, the sensation. So we sense touch and pain. Thermoregulation, can move blood near the surface and that carries it away. And then vitamin D synthesis. This helps us giving phosphorus and calcium. The skeletal muscular system, its functions here is to support, protect, aid in movement, mineral homeostasis, blood cell production, and triglyceride storage. Skeletal muscle is composed of thousands of cells called muscle fibers, providing strength and protection to the muscle. The skin, the positive thing, it could be that protects us from the UV rays. Yes, like this dot. But the negative could be that the UV rays damage at the same time our skin and probably give us cancer. Another feedback could be the organs. The positive thing is that they help our system to make a good procedure, right? But the negative thing would be that a bacteria could damage our organ and the system and produce us to have a disease. Some risk factors that the skin cancer have is for the fair skin or a history of sunburns, excessive sun exposure, or having moles or precancerous lesions known as actinic keratosis. What is osteoporosis? As the word says, a condition of having porous bones. It occurs when the formation of new bones doesn't keep up with the removal of the old bone. It causes bones to become brittle and weak. The risk factors about this disease could be the hormone levels, higher or lower, the dietary factors like the people who suffer from anorexia or a gastrointestinal surgery, etc. The lifestyle choice. People who spend a lot of time inactive, like me, have a higher rate of osteoporosis than their active counterparts. If you got a chronic disease, there are some activities you can use depending on what you got. Like diabetes, you need to do some physical activity and maintain a healthy weight. Cancer, depending on the type, I found that maintaining a healthy weight, ensuring an adequate intake of fruit and vegetables you can get better. And the osteoporosis, adequate intakes of calcium and vitamin D.